Medicare doesn't make any sense. So here at Healthcare Solutions Direct, our goal is always to keep this simple as 1, 2, 3. So now that you've looked at Medicare Advantage plans and you decide that this is going to be the best option for you going forward, a lot of individuals are not explained exactly what to expect when they're going to go ahead and enroll into a Medicare Advantage plan. So let's talk about this right now. The first thing is they're going to need a scope of appointment. A scope of appointment gives the insurance agent or agency permission to contact to discuss the products that you've originally requested. It's designed to protect all parties involved in the discussion. So a scope of appointment is required by CMS to ensure that the individual is protected from being solicited for a product like a Medicare Advantage plan or a standalone prescription plan that they did not originally express any interest in actually discussing. So here are some of the requirements for a scope of appointment. So CMS requires a scope of appointment to make sure again that the individual is fully aware of what they will be discussing when it comes to the marketing and sale of a Medicare Advantage plan or a standalone PDP prescription drug plan. This is also aimed at keeping complaints down by the individual to CMS. Medicare Advantage plans, remember, are annual contracts with the private insurance company, so CMS really wants to ensure that someone is not calling unsolicited without any permission. So many companies will accept a scope of appointment either verbally, over the phone, or through a text or email. So now you have a better understanding that there will be a scope of appointment that you will need to do by either a verbal over the phone with the insurance company or through a text or through an email system. Once that's taken place, there is a statement of understanding and disclosures that you will need to go through. An individual who's decided that the Medicare Advantage plan is going to be their best option, the insurance agent must now review the summary of benefits of the plan with them and go over the disclosures. They must clearly point out the benefits of the plan along with the costs that are associated with that plan. Towards the end of the enrollment, the individual will be read and will need to acknowledge what's called a statement of understanding. The statement of understanding will go over some of the basic acknowledgments from the individual. So here are some of the basic statement of understanding acknowledgments that you will go through. The individual will acknowledge that they're enrolling into a Medicare Advantage plan that has a contract with the federal government but is not a Medigap supplement plan. The individual will acknowledge that they must keep their Medicare Part A and B and continue to pay the Part B premium unless the premium is paid for by someone else like, say, Medicaid. The individual also acknowledge that they can only be enrolled in one Medicare Advantage plan or standalone PDP prescription drug plan at a time. They will lose the plan if they enroll into another plan. The individual also acknowledge that they are joining the plan for the entire calendar year. The individual also acknowledge that the plan will only cover a specific area and that if they move out of that area, they can join a new plan in that area. So now you have a better understanding of the scope of appointment, the statement of understanding, the summary of benefits. You will be getting your Medicare Advantage card and summary of benefits either through the mail or by email from the carrier. If you have any questions about that, please give us a call here at Healthcare Solutions Direct so that we can make sure that everything is followed correctly. You get your card in the mail, you get your summary of benefits, and we'll be sure to make sure that you are getting what is best for you. We look forward to hearing from you.